Good morning, friends. Welcome to the world of sports medicine. In our last lecture, we have discussed about concept of sports medicine. Today, we'll take on aims and objectives of sports medicine, which is also very much required for discussing and informing. But before going to see that, first we'll see what we have listened yesterday, what we have learned. It was regarding sports medicine represents the efforts of medicine, theoretical and practical, to analyze the influence of movement, training, and sports, as well as hypokinesia, that is, lack of movement, on the healthy and sick and handicapped human beings of all age groups. The findings are useful for preventive therapeutic and rehabilitative purposes, and with this, we have recalled what we have learned yesterday. So, the first aim is to provide information to sports person about sports injuries. It is very much required because if a sports person is not knowing that due to some faulty techniques he may get injured, so it is our duty to inform him that he is not practicing properly, then he may get injured. Second aim is to provide knowledge about causes of injuries due to improper conditioning, faulty techniques, improper warming up, environmental factors, and improper fitness. The third aim is to provide treatment and rehabilitation for sports injuries. Medical treatments such as hydrotherapy, electrotherapy, IR rays therapy, etc. are informed to sports persons for rehabilitation and treatments because they gives them proper knowledge regarding how they can, if they got injured, how they can get themselves treated early. Last is to provide knowledge about the preventive measures of sports injuries. So these are four aims for sports medicine, which is mainly basically concerned. Now we'll go to objectives, and sports medicine has three objectives basically with it, principally which has been accepted by peoples and mass. That is, first is scientific promoting of sports and games, planning of training programs, cardiac endurance, resting pulse rate, recovery pulse rate, exercise tolerance, cardiopulmonary index, and electrocardiographic changes are a part of it. Second part of first objective is evaluation of training, because if anyone is not knowing that after getting injury a sports person has got how much recovery, which is very much required. So overtraining can easily be stopped out by absence of decrease of pulse rate after couple of months training, definite ECG changes, biochemical changes are a part of it. Then next part of first objective is selective diagnostics. In hockey, for example, goalkeeper, half and fullback, frontline players are supposed to be taken care of properly. Then for the first objective, next options are psychological guidelines and counseling is very much required. If you are a good coach, you will definitely try to counsel your athlete and give him some knowledge regarding how he can get himself out of delay. Then injury prevention is also part of the first objective, that is scientific promoting of sports and games. Then second is paraphylactic health care to keep fit and to continue to be fit may be achieved. How? By functional evaluation. if your all organs are functioning properly. A prophylactic is a medication or a treatment designed and used to prevent from occurring any type of disease. It means and progressively means you are good and well. Then detection of disorders. Then maintenance of fitness level. Definitely. If you are performing any of the activities, your fitness is supposed to be maintained. Then prevention of aging and health education for sportsmen. These are the components of second objective of sports medicine. By reading this, then we comes to the third. What are that? Sports medical services. Sports medicine may also be extended to prevention of obesity, because after taking so much exercise or doing exercise regularly, sometimes it has been seen after a particular time people starting getting obesity in different parts. Then obesity and cardiac illness. Then cardiac rehabilitation is required. Then prevention and control of diabetes. So we have majorly 3 objectives and 4 aims. What are that? I will again repeat. The first aim is to provide information to sports person about sports injury. Second aim is to provide knowledge about causes of injury due to improper conditioning, faulty techniques, improper warming up, environmental factors, and improper fitness. Third aim is to provide treatment and rehabilitation for sports injuries. Medical treatments such as hydrotherapy, electrotherapy, IR rays therapy are informed to sports persons. To provide knowledge about the prevention measures of sports injuries. What are the 3 major objectives? The first one is sports medicine has 3 objectives I have told you. First one is scientific promoting of sports and games by different methods, by providing knowledge to sports person. Second is prophylactic health care. And third one is sports medical services. So this is all about aims and objectives of sports medicine. And with this, thanks. All my description is given here. You can contact me if you want. And if you want to have some questions, you can mail me. I can answer you there. Thank you. After the lecture, there will be a question answer series. And all the students who are listening it are supposed to answer all the questions regularly. Thank you very much.